Welcome everyone. Thank you for joining me today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. Today we are reporting 26 new cases of COVID-19 in Windsor and Essex County. 8 are close contacts of confirmed cases, 6 are related to outbreaks, 2 are community acquired, and 10 are still being investigated. We have had 12,419 cases since March of 2020. 11,774 cases are now resolved, and 297 people are active cases at this time. 45 confirmed cases are currently in the hospital, and 11 people are in ICU. Our community has lost 348 people to COVID. We are reporting 3 additional deaths today. 2 people are from long-term care. A woman in her 60s who works in a long-term care home, and a woman in her 80s that is a resident of a long-term care home. And a man from the community in his 80s has passed away as well. 225 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 22 active outbreaks in Windsor and Essex County. 10 are in workplaces, 9 in long-term care and retirement homes, 2 outbreaks in our hospitals, and 1 community outbreak. Despite the beginning of the vaccine rollout, public health measures must continue. Stay home if you're sick, limit your close contacts to your household members only, maintain a 2-meter distance from others, wash your hands with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. We will now take questions.
Today we'll start with Blackburn.
Hi, I'm not sure if you would know this offhand. Is this the 3rd employee from a long-term care residence that's passed away?
I believe this is the second.
Second,
yes.
Okay, thank you.
Any questions from the Windsor Star?
Teresa, can you give us just an update on how far along you are with second doses at long-term care and retirement homes? How many homes have you completed?
I don't have the exact number. I know this week is a very busy week. We had a lot of homes. So this is Wednesday. So we've had the Monday, Tuesday, and Wednesday. We have quite a few homes that we're working on. Some homes are doing their own second doses, and we're at additional homes. So we're really on track. We do believe that on Monday there are 2 more homes, and then there's another home next Wednesday. So after the 18th will be done. However, we will circle back because there are, first doses that need to be brought to be given as well. But I don't have the total number, sorry, but I know we're doing a lot of progress this week. This is a very busy week for us.
Okay, thank you.
Any questions from AM 800?
Teresa, do we know if this worker received the first dose of the vaccine?
I don't know anything further about the worker that passed away.
Okay, thank you. And then in regards to the order that was issued last Monday, I believe it was, any charges, any warnings, fined after that order was issued?
Not that I'm aware of. Our cases have come down quite a bit, and we haven't had to enforce the order. People are complying, and our staff are following up quite closely and timely with everybody. So nothing new to report on that regarding the order.
Thank you.
Any questions from CTV?
Yes, good morning. How discouraging is it to see a worker die related to COVID, knowing that the region is so close to having that sector vaccinated?
Yeah, it is. It's hard to see all these deaths, and in the worker, this morning when I found out, it's difficult to see that the deaths continue in our community, and I do hope the vaccine, we can continue to roll it out and that it will protect people. And it is unfortunate, and it's very sad, and that is something we continue to see every day. The deaths, continue to occur, and it is hard to see workers, but it's hard to see all of the residents as well that have really done so well throughout this pandemic. And I agree that with the hope of the vaccine, we hope that the deaths will not occur and that people will be protected.
Thank you.
Any questions from CBC?
Good morning. Given that this is the second death of a worker at a care home, and we've had many workers infected with COVID-19, do you have any concerns about safety procedures at long-term care and retirement homes, and whether they're being followed?
Well, our health unit's involved when there are cases in a long-term care home or retirement home, and we have public health inspectors that are working with the home, and our nursing staff are following up, as well as support from their partner hospitals. So there's a lot of support, and even in the homes, they've been dealing with COVID for a long time, and some of these homes were experienced outbreaks early on in the pandemic. So the important use of personal protective equipment is in place. There are restrictions regarding visitors, testing. There are a lot of mechanisms in place and directives that are applied directly for long-term care and retirement homes to protect the residents and the staff. So we have seen a lot of compliance with all of these measures as we go in, and and we've provided a lot of education, and the homes have worked with their staff as well. So in Windsor and Essex County, I do think that everyone is doing their best, and unfortunately this is a vulnerable population, and we continue to see people impacted by COVID once it enters a home.
Just another question for you. Dr. Ahmed said that if he thought there was anything else needed restriction-wise after the province announced its plan, that he would implement those restrictions. I'm wondering if the health unit is still looking at the idea of imposing the restrictions, or has that been ruled out at this stage?
I don't believe that he has talked about any further restrictions at this time. So based on data and the evidence in our community, I think decisions will be made based on the current climate and what's actually happening around COVID and transmission. So right now our numbers are lower. We do know that the children have returned to school. So we're following all of that, and I don't think he would hesitate to, provide further restrictions if the data and the evidence supports that.
Thank you.
Any further questions from Blackburn?
Yes, just mentioning school. I know it's been a couple of days. What have you heard from your nurses? Has there been any concerns raised, or is back to school going pretty smoothly from a public health standpoint anyway?
Yeah, I think it is. As you said, the nurses are supporting the schools. The school just started, and so right now things seem to be going well. And again, as we had our some good practices in place prior. We continue to support the schools the best way we can, and we'll follow closely as well if anything arises in the schools. But right now, things are good right at this moment.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
AMA 100?
No, thanks.
CTV?
No, thank you.
CBC?
Okay, thank you.
Thank you, everyone. Have a good day.